Hey there, Dr. Cameron John-Gary with San Diego Chiropractic Neurology, and today what I want to cover with you is the most important treatment for lumbar disc problems. Discs have multiple functions for our spine, the first being acting as a shock absorber. The discs actually sit between each of our vertebrae and our spine, and when there is any increased load on the spine, it'll help act as a buffer. Now the second thing the discs are important for is actually creating some spacing in between those vertebrae. We need that space for the nerves that branch out from our spinal cord that actually help control our arms, our legs, and our trunk. Keeping these discs healthy is essential to keep our functions in those body parts optimized and pain-free. As we've covered in previous videos, discs are a lot like jelly donuts. They have an outer shell and made from fibrous and connective tissue that helps keep things solid on the outside, and it actually helps maintain the jelly inside, which is an inner gelatinous layer, okay? So when that outer shell actually starts to get worn down from wear and tear, or maybe you have some sort of a trauma or injury, or maybe it's just from working day-to-day stuff, that can eventually lead to a leak, or what we call a herniation. And then over time, as it sits there, it'll eventually turn into a bulge because that area will start to open up more and more. This can cause a tremendous amount of pain that can travel into things like our glutes, our thighs, our legs, or sometimes even all the way into our foot. Sometimes it can get bad enough to where it actually causes weakness in our legs and things like incontinence in our bowel and bladder. Now the good news is that there's actually a great non-surgical drug-free treatment option, and it's called non-surgical spinal decompression. So here's how it works. We get you set up on the table, we harness you into the machine. Next thing we're gonna do is target the exact angle we need to make sure that we're working on the injured disc, the exact site where the root cause is. Once we've plugged in all the other metrics, the decompression unit will start stretching your low back open. This will slowly create what's called a vacuum effect at your injured disc. Basically, it will help suction the disc back into its healthy shape again. Spinal decompression is the foundation to a good recovery from a disc injury. That being said, it is just one piece of the story. Other essential pieces you will need are things like chiropractic adjustments, soft tissue mobilization, and rehabilitative exercises. So with chiropractic adjustments, these are going to help ensure that the bones heal in a good position to reduce the chance of things like a re-injury. The soft tissue mobilization is also going to help with that, but what we're actually going to be working on is clearing out things like scar tissue and adhesions that have built up around the muscles and the nerves. Clearing this stuff out will make sure that the nerves and the muscles are getting irritated from this will stop getting inflamed from it, okay? Finally, once everything is in better position and the tissues are no longer irritated, you absolutely have to start working on strengthening your body. Simply doing a few core exercises here and there is not going to cut it. You really need to have somebody that's going to assess your muscle groups, find out what's out of balance, and help correct this. You have to learn to move with your body effectively to keep you from hurting yourself again. You keep your discs happy, and they will in turn allow you to keep doing all the activities that you love and enjoy. It ends up being a win-win situation. So that being said, if you or somebody you know are looking for help with their disc injuries, feel free to give us a call or shoot us a message so that we can help get you set up with a consultation with one of our doctors. Thanks for listening, and we'll see you in the next video.